name is Sara Trivette, and I'm a physician assistant and certified health education specialist at Turner Elementary School-Based Health Center in Albany, Georgia. So my school is an elementary school in the inner city of Albany, Georgia. 100% of the students receive free and reduced lunch. We serve the vast majority of the students in the school as function as their medical home. Hallways to Health really became aware that school wellness, district wellness committee are important to help drive the work forward, especially we're a small staff, and so we really need a wellness committee to make change in the school. So we've been very fortunate at Turner Elementary to have the support of our principal. She's on board, parent facilitator who really helps get parents on board. We have parents who come. We have students in our school wellness committee. We have a diverse range of people to try and help propel the work forward. So we have a school wellness team that helps at the school level come up with plans like we want to track at our school because those are things that we need, and these are the individual fundraisers that we're going to do. But then at the district level, because a lot of these things really require some district support as well, I've been able to be a co-chair of the district wellness committee. So yeah, we really tried to focus on policy change so that we could have sustainable change in the school, and one of the big things that we worked on was reinstating recess. So there's a policy now for the school that all kids K through 5 get at least 15 minutes of recess daily. It can't be withheld for punishment, remediation, or make-up class time. That was a huge change, as prior to that most students were not getting recess on a regular basis. We've also done a policy that in order to follow something called Smart Snacks guidelines, that you don't sell junk food to kids, so we thought outside the box when working with how to fund those. We have applied for an Action for Healthy Kids grant. We've applied for a state grant called SHAPE grant. We've also applied for a Fuel Up to Play 60 grant to help refurbish the playgrounds. We've been able to get a track built, and so we partnered with the school to find other ways to get funding for those things that needed to be done. And the School-Based Health Center helped write the grants, although a lot of times they were going through the school, and then through that we're able to get policy change. So some of the challenges that we faced with implementing sustainable wellness changes are that change is slow, knowing that even though change is coming slowly, not to be discouraged and to celebrate those small victories and then build on that. Without Hallways to Health and developing this school wellness committee, we may not have been able to make some of the same key partnerships with our administration and getting our administration on board, getting our school secretary on board. So we've really worked with integrating into the school so that we are a key part of the school and really working as a partner with the school. The changes that we've made have really been quite sustainable, and we've been very fortunate to make a lot of these changes actually at the district level, so that not only the students at Turner Elementary are being impacted by the recommendation for recess and what foods we're selling them and things of that nature, but also kids throughout the district. And these are things that really, with just focusing on using a wellness team and having a group of committed stakeholders together without a lot of funding, really are sustainable. Continuing recess, it's just a matter of making sure it's on the master schedule and that there's a policy encouraging people to follow it. Really, all of the things that we've been fortunate to do and learn about through Hallways to Health will continue and are quite sustainable and really can be expanded to include other schools down the road. We really just plan to keeping on with what we're doing, and there's no reason for a school wellness team to end, and having recess will certainly be something that is there for years to come for our students. Making sure that we're offering healthy foods instead of candy bars and other junk food is something that doesn't require continued funding, but requires a continued culture of health and wellness. We plan to be there for our students, our faculty and staff in that way, and I think everyone's really excited about the opportunities ahead to continue and expand on this work.